am so elated to meet you in the program of 1 minute please. What is MASLD? So MASLD is metabolic dysfunction associated steatotic liver disease. Actually, it was formerly known as non-alcoholic fatty liver disease. Why the nomenclature was changed? The two terms, one is alcoholic and another one is fatty. These are the two terms have been perceived as social stigma. To address the core issues, Islam et al. In 2023, he proposed the term metabolic dysfunction associated liver disease, which was widely accepted by our medical fraternity from all walks of life. So, how will you diagnose MASLD and what is the clinical significance of MASLD? So, why it gains clinical importance? If MASLD is left untreated, it may lead to MASH, then followed by chronic liver disease, then finally end up in cirrhosis of liver and hepatocellular carcinoma. And second, those who have been detected to have MASLD are prone for getting cardiovascular complication because the risk factor for MASLD and cardiovascular disease remains same. And third, MASLD can precipitate the onset of diabetes. In fact, we could say there is bidirectional relationship between MASLD and the diabetes. So, in diabetic patient, 66% of diabetic population harbor features of MASLD. And vice versa, MASLD patient can be prone for getting pre-diabetes and diabetes. And the fourth one, MASLD patient is known for getting extrahepatic carcinoma, including breast CA and colon CA. Because of above reasons, MASLD has gained much clinical importance. Then how will you diagnose MASLD? To prove MASLD, the first most important is you have to prove that 5% of hepatocytes are embedded with fat. Either it has to be proven by liver biopsy, which is considered as gold standard, but practically not feasible, or by imaging, preferably ultrasound. Once it is proven that patient has fatty liver with means of ultrasound, then you should prove patient should have at least one cardiometabolic risk factor out of 4. What are that 4 cardiometabolic risk factor? You have to remember in such a way that HOD, head of the department, H for hypertension, O for obesity, D for diabetes and dyslipidemia. So, among this HOD, H for hypertension, if somebody is detected to have blood pressure more than 130 and 85, or if they are already on antihypertensive, and second, obesity, you have to prove with the help of BMI exceeding more than 23 in South Asians, and weight circumference, that is very, very important, that is often ignored in our clinical practice. Weight circumference to be taken between the lower costal margin and the anterior suprailiac spine. If weight circumference exceeds more than 90 cm in male and more than 80 cm in female, then you can term that person to have obesity. And third one, D, diabetes. Either patient should be in pre-diabetes or diabetes. And the fourth one, dyslipidemia. Most of the time obesity, dyslipidemia, they have features of high triglyceride and low HDL with normal level of LDL, but it's small atherogenic LDL, but that you have to remember. So, out of 4 cardiometabolic risk factor, you have to have only 1 out of 4 with fatty liver, and there should not be any secondary cause. What I mean, patient should not have any viral infection, chronic viral infection like hepatitis B and hepatitis C induced liver disease. They should not have any chronic drug induced liver disease like amiodarone and valproic acid. These can produce histological changes in liver. So, there should not be any secondary cause, third. And the fourth one, there should not be any history of algal consumption, or if at all, if they have a history of algal consumption, there should be minimum algal consumption. What do you mean by minimum algal consumption? In female, it should be less than 20 gram of alcohol consumption. In male, it is less than 30 gram of alcohol consumption. So, how will you calculate 20 gram or 30 gram? Please remember that most of the alcoholic beverages contain various proportion of pure alcohol. For example, whiskey contains 40% of alcohol. If somebody consumes daily 100 ml whiskey, then you could say 40% means almost 30 to 40 gram of alcohol consumption. In that case, it exceeds the criteria of MASLD. So, if any person consumes alcohol, especially male, more than 30 gram, in female more than 20 gram, then it can't be simple MASLD. If you say MASLD, there should not be any alcohol consumption, or alcohol consumption should be less than 20 gram in female and less than 30 gram in male daily. So, these are the criteria you should fulfill for MASLD. Thank you.